I bring before you is a motion that highlights the oral health challenge of the people of Nottinghamshire. And not just the oral health challenge, but the fact that it's preventable, the fact that it's a genuine health inequality, and the fact that it can be largely dealt with by fluoridation of the water supply. All I'm asking for you today is to put your faith in me as the chair of the Health and Wellbeing Board to bring this argument forward, to bring together the ICSs and the ICBs, to bring together councils, not just in Nottinghamshire, but across the city of Nottingham and into the wider area to culminate in an improvement in the oral health of the people of Nottinghamshire, and to bring me directly to the door of the Secretary of State for Health and ask him to fluoridate the water of Nottinghamshire. So that's where we're headed if you put your faith in me today. And I think the simple thing is, why are we here? We're here because 37% of children in impoverished areas have significant tooth rot, dental decay, caries, call it what you will. Across the country, 38,000 children get admitted to the A&E department or through one way or another into hospitals to have anaesthetics, to have their teeth removed at a cost of over £50 million. This is a significant amount of illness, and you might think it could be the deciduous teeth of children, the milk teeth that would fall out anyway. But it results in pain, it results in infection, it results in change in your ability to chew food and a poor diet. As you get older, it affects your ability to socially interact. It causes halitosis, it keeps people off school, it causes great problems to these children. 37% of children in impoverished areas. That is in anybody's language, particularly in public health language, what we call a burden of disease. And when you've got a burden of disease, you are mandated to intervene, especially when it's as preventable as dental decay. So that's where we start from, a burden of disease. And as the chair of the Health and Wellbeing Board, as the chair since the last number of years, I am mandated by the government to intervene on your behalf. So the size of the problem is there. Where are we at the present moment? Some of you may know, another of you may not know. If you look nationally, only 10% of the water is fluoridated, less than 6 million people, even 90% of it unfluoridated. Here in Nottinghamshire, we're relatively well off in Mansfield, Ashfield, Bassetlaw, parts of New York and Sherwood, making up 30% of the population, is actually fluoridated. And it's interesting that that covers some 13,000 children of 5 years of age, but it leaves out 29,000 other 5 and under children. By its very existence, it is a health inequality, and we are mandated to improve health inequalities. It's not only an inequality, it's what we call an inequity. It's man-made. We have created two different systems where 30% of our kids get fluoridation, and those kids have about 19% dental caries, versus the other 2/3 who don't get fluoridation and have up to 37% dental caries. That's the difference, and that is an inequality, and we're mandated to do that, to correct it. Now, in terms of the evidence, why would we fluoridate water? Fluoridation, fluoride is the 13th most abundant chemical on the planet. It's in water, it's in air, it's in soil. It was first added in the 1940s to water in America, and we started doing it here in the 1960s in Birmingham, and the north of Nottingham has been fluoridated for the last 40 plus years. We know that by putting simple 1 part per million into water, that we reduce the amount of tooth rot, dental caries, call it what you will, by 33%, a third. If we fluoridated the water tomorrow in Nottingham, 15% of the children would be completely free of any dental decay at all. Significant reduction in the number of people going in hospital to have clearances. The evidence for fluoridation is irrefutable. It's backed by the World Health Organization as one of its prime reasons to intervene in any country in the world is to reduce dental decay, and it's promoted by World Health Organization. The British Dental Association are calling out for it and saying, let's have fluoridation. NICE, the National Institute of Clinical Excellence, has a thing called quality added life years, and it looks at the cost basis of intervention, and it says this is one of the single best, most cost-effective interventions that you can do in any realm of public health. £1 put into this fluoridation today, in 5 years is worth 10,000, and in 10 years is £21 returned on every single pound invested in fluoridation. It's an irrefutable argument. Are there any problems with fluoridation? And you'll have read perhaps various stories. People talk about bone cancer, people talk about underactive thyroids, people talk about reduced IQs, people talk about dental fluorosis. All of those have been looked at over a period of time, and in places where underactive thyroids are found, such as New Delhi in India, the level of fluoride in the water was 4.5 parts as opposed to 1 part. In China, it was similarly raised. And any area that you found that there was a potential adverse effect, it was due to poor calibration of the fluoridation of the water. In 40 years, have we had a single complaint from anybody in the fluoridated area of Nottinghamshire? No. Every 4 years, the water boards produce a report to government, and in this 80-page report, is there a single adverse report recorded? No. There is no evidence for any adverse side effects. I might say, why am I here now? 40 years, nobody's fluoridated water. Why is Doddy standing up and talking about it now? I'll tell you why. So you can't, I couldn't get to the dentist. Yes, so it so happened that in 2022 we had a Health and Care Act. And in the Health and Care Act, it did two very important things. Number one, it created the ICSs, which we're all signed up to. I'm the vice chair of the ICP. We work through the NHS branch, which is the ICB. From April of this year, the ICB has taken on the responsibility for commissioning all of the dental services in the East Midlands. So we've got a direct ability to impact how we deliver services to our residents in Nottinghamshire for the first time ever. We have that commissioning responsibility. Number two, before 2022, local authorities had to fluoridate water. For 40 years, they didn't manage to do that because the borders of the water tables, the areas covered by the water boards, are not contiguous with political boundaries, and the actual challenge of boundaries and people working together created such an administrative burden that it never got off the ground. What we've got now is a very, very simple means to do it. One man has complete charge. One man makes the decision, and that's the Secretary of State for Health. When we get to that stage, and I've gathered all the evidence from the East Midlands, and I go down and knock on his door and say, 1.2 million of Nottinghamshire wider people, here's 5 million people that want their water fluoridated, we give him that, and he has the power to do that. And that's where it all starts, once you get the evidence down there. Ladies and gentlemen, we have an irrefutable problem, dental decay. Number two, it's completely preventable. Number three, it's a health inequity. Number four, we are mandated, duty-bound, under statutory duties to intervene at that level. This will take time. You don't fluoridate water overnight. The longest journey starts with a single step. All I'm asking you to do is to walk with me. Thank you.